And another thing, to have unique identification of all what can I say, all the, when we need to identify, for example, client, facility. And another thing that we are facing right now is a challenge to us, we are working, is product registries. We don't have product registries in the country. We are, of course, we are in process of coming up, so that it helps us to now to integrate different initiatives which deals or regard with medicines. And another thing that we learned is buying of political leaders. The good thing now, everywhere you will see, you will hear, all political leaders, all decision makers, they talk about digital systems, they talk about sustainability, they talk about integration, they talk about scalability. So now we have got a very clear and very big buying of political leaders and decision makers. Of course, they already see how these systems help them. Thank you very much.
Thank you. Walter has mentioned a number of key items as far as the interoperability and the health enterprise architecture is concerned. The need for foundational systems, which caters for client registry, facility registry, administrative area registry, and all these other shared services that contribute to the interoperability in terms of as far as the systems are concerned. The need for inclusion, design for inclusion, which you have to take into consideration what is existing in terms of process and the likes. Also, building from existing and the use of local capacity, local expertise. Most of the time, I think previously we've had a number of systems that no one from the local team were able to maintain those, which has brought another challenge. And of course, the need for, including API, Universal Health API. I think this is going to help the sharing of information from private and public health facilities. Thank you. Karibu John, your thoughts?
All right, I'll try to be brief. I'm sure people have a lot of questions that we'd like to get to.
Yeah.
So I can talk about the journey that we've been through in Zanzibar. So when you think about what we've been trying to get accomplished from the Presidential Delivery Bureau, one of our core responsibilities is to accelerate delivery of presidential priorities. So you have limited amount of time that you're trying to get a lot done. So when you look at the digital healthcare system today, in Zanzibar we had about 42 systems, right? Introduced by donors, introduced by Ministry of Health, and the likes. So the question then comes in, do we then introduce another layer of complexity, or do we optimize what we have today, right? So we made a very intentional decision to say, instead of introducing an additional layer of complexity, let's take a look at what we have and see if we can optimize it and make it work together, right? So break it down into a priority list of what you're trying to accomplish. So we're talking about electronic medical records. What do we have today? At the primary healthcare level, we have Zani MR. District level, we have Shams with Safety because we outsourced. At the regional level, we have NSK. Can these guys be friends and get in a room and talk about their systems and try to identify what are the roadblocks for these systems forth? So as he highlighted, stakeholder management and engagement is really, really important. And then also looking at the desired outcome that you're trying to get to. So that was a decision, a very intentional decision that we made in Zanzibar. And for the last 3 months or so, we brought all the stakeholders in a room and have been working with them on a weekly basis for the last 3 months. And what we've been able to achieve has been significant progress in this space, right? So now, when you're at the district hospital, from the EM laboratory system, it talks to the radiology system, and we're checking off probably around the 90 percentile range, and hopefully we'll be done by the end of this month and say that you can seamlessly go to the primary healthcare and your data can move. The question of unique identifier also came up, right? So what do we use? Zan ID, National ID, Kadi ya Matibabu. I think Yamini Afia also has registered some people in their system. So who has the rich pool of data and a good starting point where we can say this becomes our reference point as a unique identifier so that the patient can seamlessly move through our healthcare system. So taking that type of approach has yielded positive results for us. And I think it's really important to do that. There's always a temptation to introduce a new system. Let's find a new player that can come and solve this whole problem. I think if we just get together, have the right conversations, have the right players in the mix, we can actually start checking off some of these things to have that continuity of care. Funding also becomes an issue. Does the government pay for it? Do we have a private partner that comes in and flips the bill and then walks away and allow us to solve the problem? Or do we have somebody who then comes in-house with a PPP approach, public and private partner? You have vested interest in seeing the desired outcome in this space. So it's not just your money that we want. We want your money, we want your technical skills, but we want you to also walk this journey with us. From all the lessons learned that you've learned from other places, you have successfully implemented these solutions, so we don't have to relearn and reinvent the wheel, right? There's a tendency of that I have seen since I've been in Zanzibar that continues to happen, right? One person solves a problem, another person comes in, tries to solve it, really make any progress. From my perspective, having that stakeholder engagement, stakeholder management, and actually working through the journey as we're building our internal capacity, taking advantage of whoever we bring in with the expertise has worked for us so far. And I think in a short amount of time, with the overall goal that we're trying to achieve as a country, we'll be able to get a lot done. Maybe not finish all of it, but I'm sure we'll leave a big dent.
Thank you. The need of stakeholder engagement, the need of understanding the existing ecosystem, the need of building from what is existing. So if everyone comes in and bringing their own technology, it's going to be a chaos. So I would want to welcome you now. It's time for you now to have a comment, addition to what has been shared, or a question. Oh, yes, we have a number of hands. Should I be the one giving the mic? Yes. The lady, karibu sana.
Asante sana. My name is Elizabeth Msoka Bright from KCMC Kilimanjaro region. Thank you very much, team, for this very important discussion. And I would like to congratulate you for thinking and also discussing this. This is coming to the point whereby we need really to improve the quality of care to our patients. And the information or data is the key. And as John, what you have said is very, very important, taking consideration stakeholder engagement. So all what you have discussed and share with us is very important. However, if the stakeholder from the community level, from the individual, doesn't know what is this benefit for all this, it won't take us anywhere. So when we talk about healthcare system, we are talking about patient. But also remember, as we are growing up, we have so-called research. So we have also researchers in the health system. So these are the people who will be using data. Healthcare personnel, including doctors and nurses, will use the data too to improve the care, but the researcher will use. So if we are now connecting the private sectors to make sure these systems talk each other, I think there will be something that the government has to bring together, as you have said, stakeholder engagement, so that one can know what will be the benefit for my people, my doctors, for the patient, for the research, as well as our partners from outside, because data is money. So if I have my paper research being published in Nature somewhere, it's something. So we have to consider this. So congratulations for this, and I hope this would be getting into a point. But there's something that I was just buzzing with my colleague here. When we talk about private sector, right now we have these so-called traditional healers. Myself, I'm dealing with breast cancer research, and late diagnosis is an issue, blaming these traditional healers that are delaying our patients. And I'm happy that recently in Mwanza, the government has decided to collect the traditional healer, giving them all this information and the issue of referring the patient to the hospital. And since I'm doing this November, I'm going to train the traditional healer on breast cancer, as well as teaching them on how to do breast cancer examination and pathway referral to the hospital. So I've seen this little consultation form to the traditional healer, whereby once they attend the patients, they will write what they have seen and refer the patients. So this is a data as well. So when the healthcare receive this piece of information, will feed into the system. I don't know how you take this kind of partners, traditional healers, into this system. Thank you very much.
Thank you. Can give it. So who is going to respond to this?
Billy, I have two questions. My first question is concerning, we are currently in the fourth industrial revolution, and the fourth industrial revolution has many components, one being artificial intelligence, the other being AR, VR, 5G, and many more. But the thing is, the talk in Tanzania is always about artificial intelligence to the extent that we are regurgitating the same things. So what are we doing as stakeholders to optimize, to utilize all these other technologies that are emerging in the fourth industrial revolution? My second question is relating to data ownership and data commercialization. So as we all know that data is the new gold, and to develop in the process of digitization, companies need data. So our data is being commercialized. But we have all agreed that the person generating the data should own the data. Now the commercialization of this data is generating numerous amounts of profits for these companies that are collecting this data. But we have all agreed that I am the owner of this data. Do I stand to profit from this commercialization, or once my data is collected, is no longer mine? Thank you very much.
One hand from this side, and we are going to respond for the interest of time. Maybe the gentleman over there, yeah, with the glasses.
Yeah, good morning.
Morning.
My name is Agaton Kimario, recent medical graduate from KSMC. I'm a junior researcher interested in the field of maternal and child health, but also I am a project manager attendee through the African Cancer Stars through the D43 Grant Award by the NIH, Dana-Farber Cancer Institute, and Harvard School of Public Health. My question goes directly to Walter and Sanjo. So, through several years, we have seen several universities trying to upgrade youth who are innovators. My senior Felix, Dr. Felix knows. So MUHAS has been doing like win and learn. So trying to figure out youth who are innovators, particularly in the health fields. As the Ministry of Health, how do you leverage these youth who come up with great ideas on filling the gap of the community? How do you leverage them to fit into the market? How do you leverage them to like solve the problems which are in the society? Thank you.
Thank you. So for the interest of time, I'll have these questions be answered first before we get another round of questions. So starting with, you want to start?
I'll go ahead and kick it off.
Yeah.
So traditional healer, I think, is the label that you put on the people that you're working with. But also you hear community health volunteers, right? People who are engaging directly with the community at that level. So this is where the stakeholder engagement and management comes in, right? Because there might be something that's already been done with Yamini Afia that can connect directly to what the traditional healers are doing, or vice versa, right? So you might have something that she's doing successfully in that cancer space, training the traditional healers that can now be an enhancement within this digital system that already exists. I think definitely the ecosystem needs to extend to that level, because that data also is important for decision makers, for the healthcare providers, and also for us to be able to monitor trends and see what's happening. So I think definitely there's an opportunity there that needs to be explored. When you talk about emerging technology, again, I pointed out before, it's important to understand the maturity level or where we are today. The buzzwords are very, very appetizing. You're talking VR, you're talking the rest of that. Where is the infrastructure today in our country? Where is the connectivity today in our country? Where is the data structure today in our country to be able to take advantage of those things? I would love to leapfrog to that stage, but I also have to be realistic in the limited amount of time that we have. What can we achieve? If and when there is a partner that can help us get there a lot faster, we're more than interested to have those conversations. But also, again, it's really important to understand the maturity level, because think about our people, where they are today, and how much they engage with technology. Think about the healthcare providers. We're struggling to even get our tablets to be used. We're struggling to get some of the data systems to be used. Now to introduce a VR into the mix, fun topic, but I don't know if that's where we need to be right now. Not discouraging it, but I'm just saying I think it's something that needs to be explored. As far as ownership of the data, I would like to say it's my data, and if there's money generated, I get some of that too, right? But again, back to the maturity level, is we first just have to have the data and start using that data to make better decisions that could possibly save lives, right? So that's where we are today. Extending that to you from a perspective of it's your data, you should also have money in your pocket, we can have those conversations. But just like content creators today are able to monetize what they do, in the past they were not. But it's something that over time we'll get to a place where this part of it is stable, we're able to collect the data structures are okay, we're able to govern the data, and then we can say, now how do you extend that benefit to the rest of the stakeholders in the ecosystem?
Thank you.
I'll stop there.
Yeah, but I think for me, life comes first before data. Or should it be data then life? If we are about saving your life, would you care whether to share or not to share your data? But that will come to that. Walter, karibu.
Thank you very much. Yeah, it is very true, and let me add this voice to what my colleague said. Regarding data for commercialization, that is for the maturity levels now, not really, not yet. But yes, your data is belong to you. You're supposed to know it. And by the way, you want to introduce consent. For example, if you want to share this data from this facility to facility X, from a facility X to a facility Y, we need your consent. So this one is already taken care. For traditional healer, yes, it is very true, and it is in our parking lot, but we already start to identify their places and include them into our registry to uniquely identify their places in our facility registries. For AI, yes, it is very true, and nowadays everyone is talking about AI. But let me tell you one thing. In the health sector, we are talking about the lives, yes, ndio. So before starting using this AI, we need to make sure, we're supposed to make sure we have clean data. Because if we collect dummy or wrong data, we're expecting the end result is going to be, and at the end of the day, we will kill people. So before starting using this API, but we encourage first to collect clean data. And of course, at the ministry or the government, we already issue many AI policy framework. It is already there. We can share with you anytime. Regarding innovators, yes, the Ministry of Health, we are very concerned, and we, by the way, we managed to establish, we call it digital Center for Digital Health, of which we welcome many young innovators to come, share their ideas, work with us, and it is very open. And we already started working with, as you said, universities from, for example, MOAS, University of Dar es Salaam, UDOM, and Sokoine universities. And we welcome. And we already issue, by the way, not the official letter, but information to them that we welcome young innovators to come to our center, share their idea, see what we are doing, and we can work together. Thank you very much.
Thank you. Dr. Felix, I want you to only address the the industrial revolution, technology, blah, 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 before.
Yes, yes, it's true that AI is a buzzword, is one of the emerging technologies that I think is well talked about worldwide, and that's because it has low-hanging fruits in terms of supporting the health system ecosystem. So the relevance and appropriateness is one thing, but also the competence that we have. So in the National Digital Health Strategy just ended in June this year, the emerging technologies were bumped into the research, innovation, and development. It's not only talking about AI, it has blockchain and big data analytics, AVR, but as we said, one of the emerging use cases is AI. Last week we had a session which one of it was talking about blockchain application in health sector. So those ones are coming out, but what we are looking at is the competencies that we have. So WHO is developing a framework on digital health for different stakeholders. The clients, how are they going to use the chatbots if you are talking of AI or these community health applications? Healthcare professionals, but also digital health experts. How many do we have with competencies, blockchain, AVR, AR, and all these mixed realities? So we need to look at the competencies, but also developing communities of practice to ensure that we build capacity first, the competencies that are required to design and develop the solution, but also application of them. So we are saying AI is 30% technology, but 70% leadership. Putting up the relevant policies and guidelines are critical. WHO is also developing this, but how do we ensure that we customize or domesticate these policies, regulations, and the likes in the context, I think is critical. And starting with, as we said, the policy, but we need to also how AI is going to affect different components of the health system. Guidelines around also data governance is critical. Thank you very much.
Thank you, Dr. Sokums. For the time, I'm told there's only 5 minutes. And hope you've been able to learn a thing or two about continuity of care and how innovation and digital technology can support this. Nafasi ya upendeleo kwa yule mdada mwenye nyekundu. I'm using my power as a moderator. Asante sana.
Good morning.
Good morning.
Dr. Justina from Dar es Salaam. My general views on these general technologies or platforms are so much improving quality healthcare, but there are some few takes I wish our panel or some of us should take home, and we should see how we can improve and where we have done so well from the field level. We have this, as much as you're trying to improve or to scrutinize in these technologies, we should look at how much they can save time. Because our main goal is to save life, true, and in anything that saves lives, you should also be time limited or time limiting. A lot of the platforms come with many informations that sometimes they're not so necessary, if I can say. Or you find a part A needs a certain information, then you also, when you go to part B, needs an information that was also answered on part A. And bad enough, you cannot go to part C if you don't fill in the part B, right? So they should be time limiting, very precise, so that we save life. Also, we should get data from that point.
Thank you. Thank you. Thank you, asante sana. Before we close, I'd love to welcome Mr. Eric Tali from PRAG to give us a concluding remarks. Asante sana. Back here.
It's an honor to be appointed this morning. Appointment, president, but also. Hello, do you hear me? Jamhuri ya Muungano wa Tanzania. Yeah, Eric Kitali, Director of ICT from PRAG. It's a great honor to. It's a great honor to issue a concluding remark after the great discussion from the great panelists. Actually, when they were discussing this topic, I break it into three. 1, innovation and digital technologies. 2, uninterrupted access, which is the continuum of care. And 3, quality health care. When you look at that, first and foremost, before the quality healthcare, and before innovation and digital technologies, we have to see or look at in several assumptions which can lead us to quality of care using innovation and digital technologies. And the issue here is, are we going to put the cart before the horse or the horse before the cart? That is really critical and really important. So what I've summarized, first and foremost, we must have the proper requirement. And in this case, most of the time, Dr. Sukum said, most of the time we put all the blames to ICT guys because we didn't have proper requirement. And in this case, even report requirement must be within the SRI, system requirement document. Another thing which hasn't featured very well in this discussion is enabling environment. You must have state-of-the-art technologies, state-of-the-art applications. But if you don't have the enabling environment like power, equipment, networking, accessibility, and all that, you may find you cannot attain all what you want to attain. Another thing which I got from this discussion is skilled people. You know, confidence without competence is confusion. And most of the time people are so confident and the competence are so low. For instance, on the emerging technologies, you know, whenever you go to a meeting, and if you are ICT personnel, if you don't mention the VR, you don't mention blockchain, you don't look like you are modern. And we really need to have the competence within that before we advise going to that route. Another thing is, you know, if we are looking at system integration, we must start with people integration. People integration leads to process harmonization, and later system integration. So people integration must start first before that. Another thing which we have to look at this, and this is coming from my dear sister Mutabazi, is the resources. You know, we must embrace on the less for more. Less resources for more output and for more outcomes. That is really, really important. Yesterday, I was having a discussion with colleagues from private sector, and they were seeing how best they can work with government. PPP is really crucial, but how are you engaging with the government is really key. We embrace on the integrity. What you say, what you preach is what you drink. You preach wine, you drink wine. Not preaching wine and drinking water. That's really important. And mutual trust and respect. If we are not trusting each other and respecting each other, we cannot move. Most of the time we find partners are not trusting very much the government, and sometimes even the government are not trusting very much the partners. So we must have the mutual trust and respect between the two. Another thing is the ecosystem. When we are developing the systems, we must make sure we are taking care of all the issues, the details. You know, the devils are the details from end to end, from the start to the end. That is really, really important. Most of the time, the academia, Dr. Felix is here, the academia and practitioners, we are not working together. I heard a friend, my colleague there, talking about the innovation and the research evidence. We have to make sure how are we bringing together the academia and the Walters, the government or the practitioners. We have to see how best the research evidence is really shown in the practices and innovation. Last but not least is we have to see and visualize when to comply and when to challenge. Sometimes you need to comply, sometimes you need to challenge. Now the wisdom is there, when to comply and when to challenge. Most of the time you challenge where you are not supposed to be challenged, and where you are supposed to comply, you keep on challenging. So we have some policies, we have some guidelines, we have some acts where we need to comply and as practitioners. Lastly, we have to maintain the best PR, personal relationship. You know, sometimes you may know everything, state of art, but if your PR isn't that okay, you may find most of the time you cannot achieve what you want to achieve. So the network of experts and PR is really important in this culture. So after saying that, Thank you very much for this panel. And for you who have been attending this important session this morning, you have started your day very well, because the issues which have been discussed with these distinguished panelists are really important towards digitalization in healthcare. Thank you very much.
Asante sana. Thank you very much, and this marks the end of our panel for today. Asanteni sana kwa kushiriki. Naomba tujipigie makofi wenyewe. Ni ya kwetu. Tujipigie makofi wenyewe. Asanteni sana. Asanteni sana. Karibu tena. Asanteni sana. We can have a photo. Yeah. Yeah. Picha, wameomba picha, sio mimi. Wow. Naombeni mpige picha. Picha pamoja. Na mimi nitatokea. Should we stand? Okay. Picha.
Good morning. After the picture session, there is a training that is for 10 minutes from TMHS on how to transport a patient on a normal vehicle. So for those who are interested, may you please stay after the session so that we can have the training.
Good morning, good morning, good morning.
Yeah, sorry. People hate it. No, I know I'm Dutch. Yeah, the Dutch. Yeah, nice to see you as well.
Hello? Hello? I hope I'm audible enough. The training session is about to start for 10 minutes. I would like for those who are interested to sit so that we can start. Hello?
Hello, hello guys, excuse me. Can we please sit for 10 minutes? Dear delegates, can we please sit for 10 minutes? There is a short talk about how to transport a patient in normal vehicle. Please, we need your attention.
Do you know where?